So the numbers are out, and we're seeing that more Black people are dying from coronavirus than white people, right? So we want to know why. And based on institutional racism, which is pretty much the way our systems are designed to affect us disproportionately, of course, Black people, it's really translating into three things for the Black community during this pandemic, and that is living conditions, um, access to health care, and work circumstances. Okay. Our living conditions, Black people usually live in the most densely populated areas of any city, town, or, just any area. A densely populated area means it's heavily populated. It also, these areas there's usually not a great big health food store or a big chain grocery store, and if there is one in these areas, it's usually just one store. The rest of the neighborhood usually has like mom and pop shops, so that creates a problem for Black people having to shop for healthy options. Also, really, the most important part of that is with the access to food is when you go to a side of town and you realize that you're on the Black side of town, you always see fast food places like fried chicken places, taco places, or burger places, right? You never see Chick-fil-A's, or hardly ever you see a Subway or anything like that. So within the Black community in these densely populated areas that we typically tend to live, there's usually not a lot of healthy eating options, which lead to people not really knowing how to eat healthy, which leads to hypertension and diabetes and all these other things that they call underlying conditions that complicate the coronavirus in the event that you are affected. Okay. Work circumstances. A lot of Black are deemed essential workers, essential jobs, essential workers, and they work in the service industry. So this means that a lot of our 30% of our population, 25 to 30%, are working jobs that don't offer paid sick leave or really great health insurance. You may have part-time health insurance, so there's not a lot of preventative care happening within the Black community because the insurance is not usually adequate insurance to sustain your life. And also, most of the time we're having to work and we can't afford to take off of work. Okay. And that is due to income inequalities, another thing of institutional racism. Inequalities in healthcare. Think about it. When you are on the Black side of town, how many urgent cares do you see? Okay, so in the event that you were to get sick with coronavirus, how likely is it that you will make it to a reputable healthcare system? And then how likely is it that they'll take you seriously based on the symptoms that you are exhibiting or even describing? Because that's always been a stigma within the healthcare system that, we just don't get treated the same when we're seeking attention from healthcare providers because we're often not believed. So that's pretty much why Black people are dying off faster from coronavirus than white people. What can we do about this? Pay attention to the numbers in these reports that are coming out, because the only way to correct this issue is to have eyes on the issue, right? So if we know that there's a concentration of an infection in a certain area, they need to ramp up testing, get testing available for everybody so that we can practice safe quarantining, because in densely populated areas it's really hard to social distance if you're living in apartment tower buildings or areas where the houses are close together or things of that nature. We have to pay attention to the numbers, and we just have to make sure that we have leaders who are looking at us, right? So you want adequate testing. You also want to be able to have medical intervention faster in the event that you need it. And then you also want to have safe quarantining going on. So at this point, we don't really have that because we don't really have adequate testing for starters. A lot of leaders are behind on the racial data because private labs are not submitting that information to the states that they're testing in. They're not required to submit that information, right? But we know what's going on. So this is why Black people are dying at a faster rate than white people from the coronavirus.